So I think the first issue about big data in healthcare is really to define which data we're talking about. And there are actually three kinds of healthcare data that are important. The first one being electronic health records, which is the medical history of a patient over time. The second being biological data, which goes from genomics to the amount of bacteria that you have in your gut and which is specific to every individual. And the third one being the so-called quantified self data, which is all the measurement that you can do on your lifestyle, from the steps that you walk every day to your levels of blood sugar.
Well, it will surely help the communication and avoidance of duplication of techniques. It will also increase the communication and for both the professional and the patient, because professionals will be able to look at the data records of the patient, all data, not only the ones they got themselves, but also other available data from hospitals or other sources. And for the patient, they will be able to look at their healthcare record and see what is mentioned there.
There are certain risks. I mean, the first risk obviously is access control and privacy. Who will have access to this data, when and for what? And this is something that needs to be discussed with patients and healthcare practitioners, obviously. There is the issue of communication in that in order to have better uptake of eHealth and big data in healthcare, you need to educate healthcare practitioners and patients. And there is also the issue of standardization, where today health records and data is completely disseminated across many care providers and across many member states, and there needs to be a more unified approach.
Policymakers, I think, are very aware that personal health data is very sensitive to individuals, and therefore it must be protected and it must be controlled. But it's important to recognise that research, for example, has very secure systems already in place to make sure that individuals' data are safeguarded and they're looked after and they're used responsibly. So this is things like approval of projects by an independent ethics committee. It's very important that those safeguards are there and that the regulation works with those rather than creating new barriers that won't be necessary to add additional protections for individuals' health.